A new medical service is in the works in the Champaign area, but this one caters to the K-9 patient. Champaign Police, the U of I Police, Aero Ambulance, and the University of Illinois have teamed up to provide ambulance rides with emergency care for injured K-9 officers. Joining us on this episode of the PAW Report from the University of Illinois Veterinary Teaching Hospital are Doctors Maureen McMichael and Ashley Mitek to talk more about this program and others supporting our police dogs. Stay with us.
Dave's Decorating Center is a proud supporter of the PAW Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
OCA Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the PAW Report on WEIU. OCA Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at ocavetclinic.com.
Thanks for joining us for this episode of the PAW Report. I'm your host, Kelly Runyon, and joining us today are two special guests from the University of Illinois Veterinary Teaching School. We have Doctors Ashley Mitek and Maureen McMichael. Thank you both for joining us today for the PAW Report. We have a really exciting episode, a very interesting episode about a new program that's starting up in Champaign County and expanding into other counties too. Yeah. We'll get to that in just a moment, but let's introduce our first guest, Dr. Mitek. Why don't you tell us a little bit about yourself?
Sure. Well, thanks for having us on the show. We're very excited to be here. I've been with the University of Illinois at the College of Veterinary Medicine. I've been there about 10 years now. I started there as a veterinary student, and then after I graduated in 2011, I stayed on for anesthesiology and pain management residency, which is about 3 years. And now I work in the Office of Public Engagement and do some teaching as well, and enjoy being there.
Excellent. And Dr. McMichael.
Thank you also for having us.
Sure.
This has been great. I went to vet school at Cornell, and then I did a residency in emergency and critical care. And that's a 3-year program similar to Ashley's. And then I got my first faculty position at Texas A&M. And I was there for 6 years where I started on emergency service. And then I came here to the University of Illinois to sort of reinvigorate the emergency service here, which had fallen down a bit. Mm-hmm. And it's now a thriving business, and I help supervise the emergency and critical care section. And then I have a very special interest in working dogs.
Sure, and that's what we're going to talk about today. And we're going to really dive in more to the program that both of you are very involved with. But first, let's talk about the dangers on the job for K-9 officers, because I think most people, I mean, when they associate police, they think of the human police officers and the dangers that they face. But their K-9 companions also have troubles on the job. Maureen?
Mm-hmm. So the basic dangers, which are very similar to police officer dangers, so being shot, being stabbed, being hit by a car in pursuit of a criminal, falling. We recently had a dog that fell through, he was chasing a convict through a building and fell through the roof. So many dangers, and then there's something new which is very concerning, and it's the dangers for drug sniffing dogs. There are some new drugs out there that are incredibly potent, and so in the past when a dog would sniff, they would have needed to ingest a fair amount of the drug to actually have it affect them. This new drug called carfentanil is about 10,000 times more potent than morphine, and one poppy seed size of the powder in a dog's nose can kill it. And so we're starting to see some real crises happening around the country.
And because of those crises, that's why the two of you have come together, along with some other groups and organizations, to start a program. Ashley, talk about this program that's relatively new in Champaign County.
Sure. So we kind of had the idea for this program, or we became aware of it when actually a dog came into our dentistry service. That was a dog that worked for the Illinois State Police. And the officer at that time had received some information from the Department of Homeland Security warning K-9 handlers all over the country that they were starting to see carfentanil and fentanyl products hitting the streets, and in particular working dogs were going to be at a really high risk of exposure because, as Maureen was talking about, those dogs are really, they use their nose to find the things that they're trained to do. Right. And when we heard about that, and in particular we heard there was a couple of dogs who had, they didn't die, but they became very close to dying in the line of duty because of that. In our field, the reversal agent we use, the product called naloxone, is something we use every day at the veterinary teaching hospital. And we felt that it was really important that we try to collaborate with the law enforcement officials as well as experts in human medicine to try and make sure that the people that are working with working dogs have that antidote available to them, and most of them do, especially in the state of Illinois, thanks to the Illinois Heroin Crisis Act now. Where there was a little bit of maybe an education gap was making sure those people understood how to use the drug, which isn't very technically difficult. It's just, if you haven't done it before, you have a little bit of apprehension. So we wanted to make sure that that education was available to the people who need it, so that hopefully if a dog does come across that product while they're executing a search warrant or what have you, they will be able to reverse the dog and save the dog's life in the field. Because, as Maureen was mentioning, these drugs are so potent that if they had to wait to receive the drug until they came to our emergency room or another veterinary hospital even 20 minutes away, that might be too late for them.
And speaking of getting to the emergency hospital, that's another program that the two of you are very involved with, and that's a program that allows these K-9 officers to travel in an ambulance. Maureen, talk about that program and how that was started.
So New York State passed a law that allows police canines to travel in a human ambulance if there's no human need, so not in place of a human. And Illinois is about to pass that same law. We think most states will follow. And what we realize is there's a big knowledge gap. When an ambulance driver gets in the ambulance with a human, they know exactly where to go. There's a trauma center and they know who's on call that night. They have no idea where to take the dog.
Right.
And so the first thing we collaborated with two MDs at Carle, and we decided we needed a transport protocol. So where should they take the dog, and have that in advance, have that all worked out in advance so that there's a connection, there's a phone number, how to get there, it's all done. And so we're creating a transport protocol that we're hoping everyone around the country will eventually be able to use. It'll just have sort of fillable form, and you can put your place and where the closest and have you contacted them and all of that. And then we also realize another gap is treatment. Most ambulance drivers have not been trained on animal restraint, and these could be potentially dangerous dogs. So they don't know how to restrain the dog, they don't know how to do CPR or basic first aid. If a dog is shot, what to do. And certainly they are experts in basic first aid in humans, but there are some differences. And the other pretty big area where it's important that they understand is people have been trained to do mouth to snout resuscitation in dogs, and carfentanil causes a dog to stop breathing. So it would be somewhat intuitive to think that you would do mouth to snout in that dog until you got help. However, if a human puts their mouth over a dog's nose and that dog has just a poppy seed size of carfentanil, that human is at huge risk.
Right.
So one of the things we've created is a protocol, a Narcan reversal protocol that we're handing out, and it shows that they should put a mask on the dog, and you can get some respirations with a mask, and then there's no danger to the handler or whoever's reviving the dog.
What sort of training process is that for the ambulance technician? Is that something that the two of you are working on too? I mean, that would have to be a process and a program. Like you said, they're experts on humans, but animals are a different animal, if you will.
I think one of the reasons why I think this has such great potential to reach a national scale and do a lot of good for working dogs is because the EMTs, the paramedics, the people who are already, working on an ambulance to help people have already exceptional levels of training and how to treat trauma injuries. And those injuries are that a human might get would be very similar to what a dog would have. So they have all the equipment available on the ambulance that we might use in the emergency room. And it's usually something as simple as just, maybe they know how to place an intravenous catheter in a human. Well, that technique is very similar in a dog. You just need a little bit of training to say, okay, the vessel you need to hit is here in the arm, a little slightly different location. There's going to be a lot of fur on top of that to get the needle through. But things like that, something as simple as administering fluids in the field can be life-saving. And if we can just take a little bit of time to educate them and work with them and train them how do you do it in a dog, and they're already incredibly proficient in doing it in a human, that right there is a pretty simple task that I think could have a lot of potential. So what Maureen is working on, what we're working on with the Carl physicians and collaborating with the handlers themselves is trying to make sure that the people who need to be educated in this effort, the people who are going to be on the ambulance, have this knowledge of how to work with the dogs. And so Maureen's done some training programs with the EMTs for Aero Ambulance, and there's plans in the work to do that with a lot of the other ambulance companies in Illinois and elsewhere.
And right now you work very closely with the Champaign Police Department and also the University of Illinois Police Department in also launching this program. Has it expanded out of Champaign? I mean, I think the big thing now is you've got the knowledge, it's just getting the message out there about this program. Is that accurate?
Yeah, we recently went to Springfield and we did the training for about 100 K-9 officers at Springfield. So it's their annual K-9 training program. And we did, Ashley did the Narcan reversal. I did some basic CPR first aid. And our dentist, Katie Kling, did a dental talk. And that might sound trivial in terms of emergency, but dental is a really big deal in these dogs because the veterinarian that sees them, usually they have a muzzle on. And rarely do they get a good oral exam. And so she taught the handlers how to do that, since in many cases they never get that any other way. So that was very interesting and it was really helpful.
What about, have you ever treated police dogs over the years? And if so, maybe you could talk about some of the injuries or situations that you've dealt with to kind of put this program into perspective.
Well, we recently had a police dog that fell through the roof, and he ended up with a pretty bad fracture that would have potentially put him out of the line of duty. Pretty bad fracture, what's called a comminuted, so shattered essentially. Mm-hmm. And we have some fabulous orthopedic surgeons, and Dr. Duffy took care of the dog and did a very complicated repair, and it ended up allowing the dog to go back to work, which was great.
Yeah, and the alternative for that patient would have been to have the leg amputated because it was such severe of a fracture, but we were really, really fortunate to have, as Maureen said, the orthopedic surgeons that were able to take a fair amount of time in the operating room to kind of reconstruct the limb. And we also were able to use our CT scan, which is state of the art, the same CT scan that you'd go through if you went to a big human hospital. And that really helped the surgeons planning that surgery and coming up with 3D models of how do you put those pieces back together to give this patient the best chance of going back to work. And at least at this point, he's a few months out, it's looking very well that he's going to return to duty. And I think he was He's 11 years old, but he still wants to keep working. So that's the great thing about working dogs that keep us motivated is they just want to get up and work. They just want to help people and keep the community safe. And I think that we really owe it to them to give them the same quality of care that the officers would get or that any human would get if they were, law enforcement agents. So.
We're recording this interview in mid-June, and today it's in the 90s.
Yeah.
I would say heat is another injury, so to speak, that K-9 officers experience. Is that accurate in saying? And do you see, K-9 officers come in? They're working in a fur coat, and then in some cases, when you put the bulletproof vest on those officers, it's even hotter.
That's right, and sometimes they can't get out of the heat. There are times when they have a SWAT team and they have to watch a building and they can't leave, and they're in the direct sun. The dog cannot go in the shade. But I will say that it is extremely rare for us to see a K-9 officer with the handler present that has heat stroke, because the handlers are very aware and they are frequently cooling them down or giving them water. The way we do see it is in the car. And so a police officer leaves the dog in the car with the engine on and the air conditioning going, and leaves to go to court, where they may be there for 10 minutes or 4 hours. And then the car stalls out, maybe 10 minutes into it. And there have been multiple deaths where the police come out and the dog is already gone.
Deceased.
Because it doesn't take very long in a hot car in the summer. And that's a real problem. There are some sensors that the police have, some sensors that can tell them if the car is getting hot. They don't seem to work very well. There have been dogs that have died despite the sensor. So we need some better products, I think.
Yeah, and I think another thing that's interesting, as we're working with these handlers, you realize what are the concerns they have, right? We look at it from the science, the veterinary perspective, but we're not in the field. And that's why it's great to collaborate with them and hear what their thoughts are. And the other thing I learned that I was surprised by is a lot of working dogs need to get acclimated to the sound of gunshots. And so they often would take them to a gun firing range and have them get used to that. And a lot of times those dogs don't wear earmuffs like people do. And it turns out that they can actually have a acute traumatic hearing loss from that happening. And so that's another area that we're potentially going to work on with maybe some bioengineers, coming up with some earmuffs for dogs that work really well and protect their hearing, though they still allow them to get used to the sound or maybe the vibrations of gunfire, but at a not a toxic level. And that's also an issue in dogs who have to be flown in helicopters as well as airplanes. So the Marines, the Coast Guard, there's a lot of agencies where dogs are trained to drop from a helicopter. And it's just as important that they have their hearing protected, the same as people do. But their ears are a little bit different shape than ours. So, the earmuffs for the humans don't always work on them, although that's something some people have tried. So we're excited to maybe work on that project as well.
What about their pads? I bet you see injuries with their pads too. I mean, we see it, I think it's now in the media a lot because of the heat and the hot pavement. I'm sure that would be one thing, but also just items, if they're on a scene. Have you witnessed anything like that?
Yeah, and there are, so think about the World Trade Center. So the dogs that walked on that rubble got all kinds of cuts and scrapes and all kinds of damage. And there are not very good products. There are some products that are good. It's getting the dog to keep them on. Little booties. The dog doesn't want the booties.
Shake. It's kind of like the cone that they don't.
That's
the cone of shame.
Exactly. And so there are other products that are actually easy to use. They're just basic plastic wraps that you would use in your kitchen that you can sometimes just have with you and throw on and just tighten them. Not too tight, but just wrap it and use that. That would be for rocks or debris, and it could help protect a little bit. For the heat, it's real important that they're not on the hot pavement for too long. And again, when they're searching and doing a search and rescue, we talk about acclimation. You know, we had, when I was in Texas, we had a dog who had actually been to the World Trade Center, Brittany, and she'd born and raised in Texas, and she was about to go to the Utah Olympics. And this was right after 9/11, it was that winter. And she had never been out of Texas, and she would be in minus 25 to 30 degrees for 12-hour shifts at night, walking in the snow. And so we did a lot of acclimatization for her, and we got little booties, and we got multiple pair of booties. She had a nice warm vest. And the key is to make sure that they're out of the wind for a certain period every day, because that's exhausting.
Now, is the program, the way that I understand it, going back to the opioid program that you're launching, and also the ambulance program, is that waiting on a state law approval, or is that something that's been implemented now, in the process of being implemented, and then being introduced maybe to other surrounding counties?
Yeah, I think we're not, what we're doing right now, we're still actively teaching and providing that education, where it's really important for us to collaborate with legislators and to have their support and involvement. One is, financially, if there's a need to have the resources to have the naloxone available to the dogs or make the education available. I mean, the videos we're creating are completely free, but sometimes that takes an infrastructure to do that. And the other thing is, these dogs that are out in the field that need the naloxone, there's a little bit of a gray legal area, so to speak, as to how do we get the naloxone to a K-9 handler, even though they're not a licensed veterinarian. And that's where we might need to have help, maybe tweaking some of the practice laws or adding an amendment to the Illinois Heroin Crisis Act, because what that act does is it allows you to go to Walgreens or CVS or wherever to go get a prescription for the reversal agent, and for the officers, it doesn't really make so much sense for them to have an individual script for each dog, so to speak. There needs to be kind of a easier way for them to get the product and then be able to give it to their dog, if that makes sense.
Sure. And I think one thing that you probably continue to work with is getting your message out. One way is by coming on programs like this, but I think that's key into making both programs a success too, and that's ongoing.
That's right, that's right. And part of what we do is certainly we do in-person training, but we can't do that for everyone. And we do believe that the Illinois law will eventually become state, countrywide. And so part of what we're doing is, as we're doing the in-person training, we're trying to film as much as we can so that we can make this available online for everyone.
As we have a couple minutes left in our interview for this segment, I guess as we wrap up, talk about the importance of these programs and why there is a need out there. And somebody watching may take the initiative to contact their local legislators to say, hey, this is something that I believe in and I think should happen. So as we wrap up, final statements on the need or the importance of what you two are doing.
Sure. So right now, you can get naloxone without a prescription from your doctor. You can just go to any pharmacy and get it, only for a human, not for a dog. And we would like that to be made so that you can get it for your working dog as well, just as easily. And it's very, very important that we get the message out how to give the naloxone to the dogs. And I just feel like these dogs might be searching for my children or grandchildren someday. We had a police dog at the U of I who went searching for a little 6-month-old girl who was eventually found. And that's what these dogs are out there doing. They're saving our lives and helping the community. And I think it's really important we get the message out.
Ashley?
Yeah. No, I agree with everything Maureen said. And I think, unfortunately, if you look at what's going on in the world today, there's a lot of not so great things happening. And I was reading an article the other day that was talking about how the Department of Defense has spent over $100 million to try and recreate a working dog. So can they make a piece of equipment, a computer, a piece of technology that can do the things that a working dog can do? And you can't do it. And that tells me that working dogs are going to be part of our community for a very long time. And if anything, we're going to start to see them even more frequently. And if you look at the statistics, that's what's happening. And I think they're being exposed more and more to hazards on the job. And it's our job as, you know, a veterinary profession, as a college that has a mission to educate, as well as, you know, human physicians and handlers and legislators to really come together, because these dogs deserve the best care that we can absolutely provide for them, for sure. So
absolutely excellent. Well, thank you, Maureen. Thank you, Ashley,
Thanks
for
for
making
having
the
us.
trip from Champaign and from the University of Illinois Veterinary
very.
Teaching Hospital to spend a few moments with us. I'm sure this will be a topic that we will continue to follow. So thank you both for joining us.
great. Thanks for having us.
Thank you.
And thank you for joining us for this episode of the Paw Report. We'll see you next time.
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at okawvetclinic.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.